welcome to the Medical Pulse podcast, where we explore the journey of becoming a doctor. I'm Anish Mohan, and in each episode, we dive into the challenges, rewards, and realities of medicine through conversations with doctors in a variety of fields. Whether you're aspiring to join the medical field or just curious about healthcare, this podcast is for you. Let's get started. Hello, everyone, and welcome to the second episode of the Medical Pulse podcast. I'm your host, Anish Mohan, and I'm so excited to be joined by Dr. Iyer. Doctor, thank you so much for joining, and I'm excited to get started.
Thank you. Thank you, Anish, for giving me this opportunity, and I'm happy to answer any questions you have.
Thank you so much. So, for this episode, we will be talking mainly about the future of healthcare and how AI and technology are helping and transforming how doctors work, patients interact with doctors, and how they're treated. So, let's go ahead and get started. So, first off, just tell us a little bit about yourself, just for me and all the viewers, what you do, what your role is in medicine, and why you like what you're doing.
Absolutely. I am Priyanka Iyer. I'm an oncologic endocrinologist at MD Anderson Cancer Center in Houston. I treat advanced thyroid cancer patients. I am not an oncologist by training, but our education now has been so advanced. We have a subspecialty or a subspecialty called oncologic endocrinology, where we are trained to treat patients with endocrine tumors using oral drugs as well as immunotherapy. So that's what I do. I also do a lot of research. I do have some clinical trials that I am a part of. I also conduct and participate in real world studies where AI definitely has a big role or a potential role to play in down the road. And I also do teach. I am a faculty and I'm the Associate Program Director of Oncologic Endocrinology. I do mentor fellows and trainees, so that's a big part of my job as well.
Well, it's safe to say that you have a lot of experience in the medical field and in healthcare. So I wanted to ask a couple more questions about you.
Mhm.
Uh, because a lot of medical students want to get into medicine at an early age. For you, what do you think sparked your initial interest in the field of medicine?
So my interest in the field of medicine was mainly what sparked my interest. I grew up in India, and what I loved about practicing medicine in India was it was very simple and straightforward. And I saw that there was no retirement age. Now I know the current generation believes in making a lot of money and saving up for retirement early enough so you can retire early, that you don't have to work. I personally enjoyed interacting with people, listening to their problems, and what I thought was, being an internist or being a non surgeon physician would allow me to practice until I decide to retire. That is, if I either could not physically keep working or if I was so old that I needed to retire. But I personally had a choice. So I could keep doing what I wanted to do. There was no forced retirement age, and I could just have low cost investment. Like I could just have a table chair and a patient exam room, and I could help people. And that's what drew me into medicine initially. Eventually, as I grew in my career, as I was going through medical school, I did find the research component very fascinating. And the opportunities for research brought me here to the United States. And that's why I'm here now, and I work in an academic center where I get to do both. That is, I am largely a clinician, but I also do clinical research.
So, I guess for you, the main thing was having longevity or being able to continue doing the thing you
Exactly.
love. Yeah, yeah, and
Yes.
I sympathize with that 100%. Being able to stick with the thing you love and constantly being able to do it is something that I know a lot of people want to do. So, my last question about you, then we can get into some of the general questions, is in your opinion, what do you find most rewarding about being a doctor in your day-to-day life?
I think the most rewarding part is that we were able to help somebody. And even if it is, one or two patients in a day that feel truly grateful for what we've done, I think that keeps us going. I treat very advanced thyroid cancer. I don't know if you've heard of this, but it's a very rare type of thyroid cancer called anaplastic thyroid cancer, and it's less than 1% of aggressive thyroid cancers that we see. But at our center, it's a high volume referral center, so we see at least 4 to 5 new cases of this cancer in a week as a team. And what gives us satisfaction is being able to do something for these patients, because outside of MD Anderson, they pretty much are told that they need to go to hospice given how aggressive it is. So, this allows us to not just offer hope but actually do something for them. And because we see a large volume of this rare disease, that gives us an opportunity to perform research and study this further to advance treatment in this area. So, from that standpoint, I feel very satisfied that, you know, for the world, this cancer may be rare, but for that one patient, that cancer means a lot, right? For that patient and that family that is going through this diagnosis, it's life changing, and it can really affect them. So being able to do something for these patients who are otherwise written off outside as, okay, you don't have any options, and you just have to go to hospice. I think being able to make a difference for those kind of patients really gives me a lot of satisfaction.
I completely agree. And because where you work and how you work, the cases you try to solve or treat are so special and so rare. Do you think that it poses more of a challenge than others, and how so?
It does. It does pose a challenge because given how rare it is, and we are a large volume center, we really need other centers to know that we treat this entity and to get patients on time, because this cancer is pretty aggressive. So the referral to us should be done as soon as somebody finds out that they have anaplastic thyroid cancer. So the challenge sometimes is in patient access to us, or being able to come to us in a timely fashion. We have gotten better at advertising, and more academic centers are now aware of us. But out in the community, I feel like there is still more to do. I feel
Mhm.
like a lot of community oncologists don't know about us, although we publish and we are a part of the guidelines and all of that. But still, there could be better access for patients out there to come to us.
Okay, yeah. So what you're basically saying is the stronger that the medical and healthcare community is together, the easier it is for patients to know where to be treated for them.
Exactly, exactly. So that's a huge role I'm hoping AI can play in not just in my field, but there are so many other rare diseases.
Yeah.
Being able to connect a patient to a center that specializes in rare diseases, so they can get timely care.
Yeah, I mean, that just when I think about that, I think of like there's probably so many patients, not in just the United States, but in the world that have a very rare condition and might not know where to go because a lot of hospitals might not be able to treat that
Mm-hmm.
specific condition. So I completely understand what you're saying, and where the more tight wound, or the more knit and the more close everyone is in the community, the easier it is for patients because of those connections to be able to reach out to certain hospitals and get the health and care that they need. Um,
Absolutely. Mm-hmm.
I agree. And then that's where it kind of pushes me to the next point where, because of the rare cases you treat, or just in general, the day to day life of a high pressure job, do you think tech has kind of changed how you practice medicine, or has kind of taken some stress off of you? Or how would you kind of say tech has affected you?
So, when you refer to technology, are you referring to any specific tools, or I mean, in terms of technology, the fact that we are on the internet, and if patients Google hard enough, they'll be able to find us, or if physicians Google hard enough, they'll be able to find us. But besides that, like, are you referring to any specific tool that has helped? But I can't think of any at this time.
I think for me, the 2 things mainly I was thinking about was, one, obviously AI, and then but the second one for me, I don't know if this kinda counts as technology, but a lot of the machines, like, especially in, like, the ORs, or even in in the room when you guys when there's an appointment, like the machines, the machinery, or just the overall everything working together to help the patient get a better outcome. I was just
Mhm.
wondering if in your career from the start to now, have you seen any changes that have helped drastically?
I think the ability to access medical records easily has been helpful. For example, when I started, electronic medical record system was still pretty new. A lot of hospitals were still getting it done. I mean, they were not all live. I recall rotating at different hospitals, including in California, and some of them were still paper charts. So I think technology has come a long way since I started about 15 years back. I think with the use of increasing use of electronic medical record system, particularly certain platforms where you can easily look into other healthcare records as well. For example, if there is an EMR that is being shared by multiple hospital systems, or rather, if it's the same EMR being used,
Yeah.
there is a method by which we can activate or download the documents from other hospitals so we can access records easily rather
Okay.
than waiting for a physical fax to be sent across
Mhm.
from that center, which sometimes still is a challenge if the EMRs are different. So, if one hospital system is using a certain EMR, but say the referring hospital is using a different one, that's when we need, physical faxes or physical records. But if it is one type of EMR that is common across both, then there's a method by which we can, just click on certain buttons and have access. So technology has helped us in those ways, and that way we can identify, like, for example, genetic testing for tumor. We don't have to repeat those tests if we have access to those reports, because these tests are expensive
Yeah.
and ultimately the patient or the patient's insurance is paying for it. So if we have access, and technology has come a long way. For example, now even EMRs are able to report the mutation testing or genetic testing directly
Mhm.
into the charts, so we don't have to formally contact the testing company and say, hey, please may I have the report, or we don't have to wait for them to send it either via email or fax to us. It automatically populates in the results section. So we do have a lot of progress in technology. We have come a long way in that sense, which has expedited patient care for sure.
Okay, so you said a lot of great points. You were talking about how having the EMR between hospitals makes it easier to know like the patient's history when they come in, or for
Mhm.
genetic testing. You made another great point. So it's safe to say that technology has definitely helped you for the better when starting to now. So
Yes.
yeah. So that kind of wanted to move me to that second part I talked about, which was AI. Do you
Mm-hmm.
think that just like how technology is affected, I don't know. I don't know a lot about like are there certain AI procedures or AI like agents that have been put into healthcare to help in a certain way? Have you seen any of that?
Yes, so AI is definitely growing in healthcare, and the main idea of using I think, should be not to replace humans, but to mostly make humans more efficient. Because as we are getting more sophisticated with healthcare technologies and treatments, we feel that the 24 hours are very limited, and we wish we had more time on hand. So I think AI tools that we have currently are tools, and we are looking for them to make our work easier and make us work more efficiently. So yes, we are using certain AI tools. I can give you some examples. Would you like me to give you some?
Sure. Yeah, that would be good. That would be really helpful.
Sure. So the one AI tool that is very commonly used is something that we use for our documentation. So
Mhm.
you remember I mentioned to you that, what interested me and fascinated me about medicine was how simple and straightforward it was back home in India, where, you could have a simple infrastructure, an office, an exam room. But now over the years, medical field has come a long way. We have become more complex. There's a lot more reliance on documentation. So there's more emphasis on writing
Mhm.
longer notes, detailed notes. not just for insurance purposes or for being reimbursed correctly, but also for us to go back and read the notes, or our colleagues to read our notes to understand what we were thinking or what our thought process was for why we recommended what we did. So AI does come in very handy in that area, where we have ambient listening AI tools, where they are listening to our conversation with the patients, they are listening to our conversation with our team members, and also where we can put in our own thoughts. So particularly when we are obtaining history from the patient, we are getting history from our staff, and we are processing all of that and discussing with the patient and recording what the patient would like to do. So instead of formally typing everything or dictating it, as we started using dictation tools to help our notes, now it has become even simpler. Many medical centers are actually using AI tools which help you document notes. So you're still able to generate detailed notes, which obviously you can go back and review and modify if you need to, but the bulk of it is already done for you. For example, history taking, it automatically
Mm.
records it. And the beauty of it is, the AI tool is now so sophisticated, it's listening and it knows exactly what to pick up. So unlike a dictation tool, where say you are dictating and you forget to pause the dictation, and say you are having a discussion with your colleague or teammate, it will record that too.
Mm.
Here it is listening, but it's not necessarily processing everything that you're saying into the note.
Okay.
Yes,
Got
so it's become very, very sophisticated, and I'm really impressed by what we are seeing lately. So, for example, we're talking to the patient and we talk to them about their medical condition, but sometimes we deviate, right? Like we want to establish a rapport. So we ask them about what do they do for a living, or who else is in their family,
Yeah.
or what are their family's thoughts on their medical condition, and what kind of support they need. So sometimes we deviate into small talk, and the AI tools now know when we are doing small talk and when there is something meaningful. So it's listening, but it is gleaning and using only that is necessary. So I think that has come a long way, and it's very fascinating in how these tools have become so sophisticated and very helpful actually. So and it's very quick. So unlike traditional dictation tools, I recall when I was in training, there were some dictations. We had a very old, outdated EMR earlier, where we used to dictate and it would take a few hours before it would be transcribed. And then when we moved to a newer EMR, which we are currently using, which is great, that is the best, I think, around. And, we started using a dictation tool again, using a mic, and we would dictate and it would type out pretty much immediately. But now with the AI tool, we don't actually have a mic, we're not holding on to anything, we just turn it on an app on our phones, and it records everything. And when we are ready, that means when we want a note generated, we just click on we are done with the visit, or we're done with recording, and then it within seconds generates a note. So that's very great, because I feel like we can immediately look at it when the information is fresh in our minds, and we can edit something if we need to. But I love how comprehensive it is, how meaningful it is, and how intelligent it is in its true way, that it knows when to not record, or rather, even if it's recording, not to write stuff in the notes, and knows what to write when they do have to write something. So it's very fascinating how truly intelligent some of these tools are.
I mean, yeah, you brought up a lot of great points about AI. One thing that really intrigued me was AI tools starting off going from just listening and writing down everything you say to listening and processing everything you say to listening, processing, and figuring out what's important for the conversation and what's not, which I thought was really interesting. Being able to go and determine what is needed for the EMR or the record and what's not.
And I think that's a big win here because there are some patients who, when they write reviews for doctors, or when they're upset, they say that their doctor was looking at the computer and typing notes and not making eye contact. So now we can actually focus on listening to the
Yeah,
patient, making
yeah.
that eye contact, working on our body language with our patients, so that way they feel that they're having a conversation with us,
Yeah,
and we are not trying to jot down everything that they say into a note,
yeah,
so
I agree.
which was a phase when we didn't have these AI tools. So now it looks more informal while it is still formal, but we are no longer as worried about, okay, are we documenting everything that they're saying, because there is something doing it for us.
And your response perfectly pushes me into the next question I wanted to ask, which was how do you think AI is going to strengthen or weaken the patient doctor relationship?
Well, there are pros and cons to that because, it does strengthen the doctor-patient relationship in the during the visit in many ways because, like I mentioned earlier, we now have access to diagnostic tests or molecular tests very easily if they are, in the same platform. We are also listening more to our patients rather than focusing on documenting because these AI tools are doing that part for us. However, certain AI tools are also being used after the visit. For
Mm,
example, say you want to chat with your doctor. Now, obviously, we are busy seeing patients, so we cannot and be available to chat with patients when we are some busy with somebody else. So there are some AI tools which do that for us. For example, there could be a patient chat or a live chat in patient portals that can be helpful in some situations. For example, say the patient wants to know, hey, did you receive my lab results that I did at another doctor's place? So that AI tool can go in and say, oh, we haven't received it yet, or we have received it yet, but the doctor hasn't seen it yet. Things like that. So that's where it does help because that way the patient is not just sending a message and they know that the message has gone into this big pool, but we don't know when it'll be addressed. So at least there is an AI tool to help with that. But then on the flip side, it also may set, I think, I'm not sure whether it really sets a false expectation, but just like how we are used to instant gratification now with just social media and technology, I don't know whether it is setting a wrong bar for
mm,
expectations that all their questions will be answered quick enough, because sometimes we just need to gather all the data to process things. And while we may have some results, we may be waiting for some other results which we haven't received yet, or we may be waiting to have a multidisciplinary discussion. But so then the patient's question goes into this void, or the a perceived void. It's not in a void, but it's in a perceived void because now you have this AI tool which is responding promptly to most of their questions, and then there comes a point where they don't have an answer.
mm.
So that can be tricky in my opinion. If a patient understands that yes, that needs human intelligence now to process all the information, and AI stops right there, if they're willing to accept that, then sure, it's a great tool. But I'm not sure how much patience people will have as we get more efficient with all these tools, and as we get used to faster results, faster search results, faster answers. And at the end of the day, web browsers like Google, etc., would, or ChatGPT would probably give them answers faster than a human would. And a lot of times there's misinformation out there. So that's why they rely on their doctors. But when does it come to a point, when do we cross that line where they
Yeah,
rely only on those AI tools versus listening to professionals?
yeah.
So that's where I find that it can be tricky. But for the most part, I think it's a very good progress that we made in this area.
Okay, that's actually what I was about to ask. It was kind of like, at what point do you think that maybe people rely too much on AI and probably don't put enough credit or enough faith into what the doctors can do? And I really liked what you said in the beginning when we started talking about AI and tech, is that AI is a helpful tool to assist doctors helping patients, not AI helping patients. AI helping doctors help patients, which I think was a very good statement. I thought it was a very understanding statement of like maybe a missed what a lot of people miss maybe now. They think that AI has become more of like this player that can diagnose and symptoms. Because I did an internship this summer where patients would come in, the doctor would tell them something, and they would say, "Oh well, ChatGPT told me this, so why? How come ChatGPT is telling me this and you're telling me this? Which one's right?" So that's where,
Yes.
yeah,
No, that's a very good point, you, because one thing that people need to remember is responsible handling of these tools, right? Because I mean, sure, Chat GPT is the new Google, right? People used to Google their symptoms previously. Now Chat GPT is the new Google, like it gives you AI answers. So at the end of the day, it's about, it's adulting at the end of the day, or whoever is getting this information, it's up to them how they process it. We cannot make that decision for them. And like I said, these AI tools are here to assist us, not to replace us, because AI does make mistakes,
yeah,
and I have seen them making mistakes. Now, they can help in simple situations, or suggest certain diagnoses, etc. But can they completely, you know replace a physician's thought process? I'm not so sure. I don't think we are that refined yet. And I get this a lot. I get this every day when I'm in clinic, where we have patients who say, I looked up on Chat GPT, and this, my symptoms fit in with a thyroid problem. And I'm pretty sure that this is a thyroid problem. And then we have to counsel them on, now we have to do, like a relearning, or we have to try to teach them how to unlearn what they learned on, online tools or Chat GPT. But at the end of the day, I'll be honest, we are sometimes at a loss,
mm,
because some patients trust us, and they value what we bring to the table with our years of experience and rational thinking, and some don't, and they shop around. And
yeah,
that's okay. Nowadays, with so many doctors available, with easy access to second, third, fourth opinions, I think there are a lot of patients who shop around to find an answer that fits them.
yeah, and I,
And
yeah, yeah,
yeah, so that's unfortunately how it is. And that's okay. Like I tell my patients, here is my assessment, and here is my suggestion and recommendation, but the decision is ultimately yours. So I believe in shared decision making. And if we don't agree on something, I may not agree with them, but I respect them and their opinion, so they're welcome to seek out another opinion which may
yeah.
be a better fit for them.
Yeah, I agree with what you said. So I just think about everything you said about AI and tech and like how much the healthcare and medical field has changed because of it, how the diagnostic process has changed, how doctors are able to treat patients, and how patients think of a hospital, like you said, when going into the doctor's office. Them in their back of their mind, they're like, okay, after this, maybe we're going to go to the three other hospitals next to it to get opinions on all of those. So an important question I think for especially students watching this, are you think there are certain skills or traits that future doctors should develop to stay ahead, especially when they start going into medicals, pre-med, medical school residency? Are there things that you wish you had or you think that people should have now?
I think the times have changed a lot, in the 25 years since I've joined med school. And I think it's getting more competitive. The one key skill that, I think more people should work on is thinking outside the box
Mm,
and being open minded. I mean, sure, there are algorithms and guidelines to guide you, and one should stick with them. But medicine is not black and white. So anybody going into medicine has to understand that you may learn a few things in theory, and you may try to apply that, and it'll work in majority of cases, but not in all cases. So being able to think outside the box and being able to listen is a key, because right now we are become so fast paced, and like I said, medicine has changed a lot since between I joined and where I am now. There is an emphasis on seeing more patients for the doctor, so we are all pressured to see more, do more in the same limited amount of time. And conditions are getting complex. Medical conditions are now, as we learn more about them, we realize they're so interrelated. So we need to find out ways on how, and each one will have different skills. So we need to find out what works for us and stick with it. So there may be certain note taking tools, or there may be certain tools that you may be good at and you want to use them in being more efficient, and there may be something that another person needs to work on.
Mm.
For example, typing, everybody learns typing these days, and they're very good with making good notes. But in that process, how much is the listening? So being able to listen, being able to let people complete their sentences. I feel like, some young people who have seen, who want to get into medicine, they are in a hurry to tell us what they want to do in their life and what they want to achieve in their life, and that's great. We want to hear all about it, but the listening part is not there. They
Mm.
shut down when people are
Yeah.
giving them advice.
Uh,
The other thing one person or anybody who wants to go into medicine needs to know, it is a long process.
yes.
It's more competitive, it is a very long process. But I will say this, there is a huge demand for doctors, because now we are also competing with mid-level providers and
Mm.
physician assistants, nurse practitioners, and they are excellent in what they do, no doubt, but they don't have the years of training or a similar curriculum that doctors have been trained with. And we welcome them as a part of the team, and I really appreciate what they do in supporting medical doctors and MDs and DOs. So the newer generation of doctors need to know that it does take time to reach your level, because you'll be heading these team or leading these teams. There's no shortcuts to success, and having that patience and resilience is the key. Because what I'm seeing, some younger folks, they want to make money quickly. So sure, you can make money quickly with other lines. It takes a long time. It is an expensive process to complete training and all of that, but it is very rewarding at the end of the day,
Yeah.
and a lot of job security and job satisfaction, depending on which line you go into, obviously. But yes, it's very, very satisfying. But being patient and resilient through the process is what one needs.
Yeah, and I think that if you walk down a street and if you see 5 kids, I bet at least one of those 5 will say that they want to be a doctor, and that's what I've seen in my school with my friends and just in general. A lot of people that want to go into medical school know they want to go on early, and I don't know if that's a good thing or bad thing because they haven't had time to really explore other options, but I think that a lot of people know that being a doctor is a long and tedious process, but I don't think they know how long it is,
Yes.
how much work you have to put in. And obviously, I've like talking to doctors like yourself and medical experts, it just further, I understand, at least for me, further how much work it really takes. And you're not done once you become a doctor. Once you become a doctor, there's still so much to learn because, like you said, it's not black and white. So that's what really is interesting to me. Like you're never done learning. You're
Mm-hmm.
constantly learning and growing and understanding new outcomes, new diagnostic tools, new patient outcomes, which in my opinion is my favorite part about medicine. So yeah. So I guess my last question would be final thoughts, more of a general question. What would be your final thoughts for students that want to go into medicine, like high school, maybe even pre-med students? What would be your final advice or thoughts for them?
I think they should definitely pursue their dreams if that's what they want to do. Is if they want to be a doctor, they should pursue it if they strongly feel about it. I do want them to also explore other areas or other specialties, particularly in college, because you can become a doctor after any field that you choose in college. For example, I have colleagues who did, something in arts. They did something in language,
Mm.
and then they still became a doctor. I have colleagues who did engineering as a part of their pre-med, and they are still doctors. So keeping an open mind is the key. That way you don't get too burnt out or stressed out trying to just, check the boxes for a good med school application.
Yeah.
But you also learn and enjoy other specialties along the way, and, you know, have something as a toolkit. Because as much as we say there is job security and job satisfaction in medicine, it's nice to be skilled in something else
Yeah.
too. Because what if you can't practice as a doctor after a point, for whatever reason, be it health, physical health, mental health, or life changes, some who knows how what life gives us down the road, right? So being able to pivot, being able to take on a new trade is something that you may lose if you don't keep your mind open. If you're only focused on medicine and fulfilling all the check boxes on a med school application, then you are not having a plan B. So it's always good to have a plan B, is what I would tell the students now, the high school students, that have a plan B, and you may not use it as a plan A, but it will come in handy at some point for sure.
I agree. And just one last thing I wanted to say. I completely agree with what you said about college, like people wanting just to check off every box in the application. You would think that's what would happen in like pre-med med school. But even my age, people 15, 16, 17 years old, the only focus they have right now is trying to check every box, doing every extracurricular, making sure that their resume looks the best it can at 15 years old, where I know a lot of people that are still figuring out if that's even what they want to do. So I guess I just want to say I completely understand that point coming from a high schooler that sees a lot of different people who try to accomplish their goals in a lot of different ways.
Yes, absolutely. Yeah.
Yeah, so that's all I have. I really, really appreciate the insights and the kind of knowledge you've given us. So, Dr. I want to thank you once again for joining the Medical Pulse podcast. Hopefully, we can have you on again another time. Thank you so much, and I hope everyone comes back for the third
Thank
episode.
you for the
Thank you so much.
opportunity. Happy to, chat offline with anybody if they have any questions. But all the best to all the medical wannabes.
Thank you. Thank you. Everyone, thank you so much for joining. Dr. Iyer, thank you
My
so much for
pleasure.
being on the show. And we will see you guys in the next episode. Thank you so much.